HIV/AIDS, a disease which has had scientists worldwide racking their brains for a cure for 3 decades now, was first diagnosed as pneumonia or pneumocystis carinii that mainly afflicted people with compromised immune systems. Later, it was diagnosed as Kaposi's sarcoma. The diagnosis was first done on 5 gay men in Los Angeles in the US. On June 5, 1981, the Centers for Disease Control and Prevention announced the first known cases of what would later be known as acquired immune deficiency syndrome, AIDS. It would later turn out to be one of the worst global killers of all time.
The AIDS epidemic in Uganda has gone through a number of phases. The first phase was between 1980 to 1990, when we had a lot of infections. From 1990 up to 2000, that was another phase. The first part of that decade, we saw the number of infections dropping. One, because people actually got the message and reduced their sexual partners. That is one of the major causes of HIV infection in Uganda. Multiple sexual partners.
The epidemic turned pandemic has destabilized national economies and revolutionized medical research. In Uganda, the first severe case was reported in 1982 along the shores of Lake Victoria in Kakuto, Rakai. The disease spread faster, especially in urban and semi-urban areas.
The complacency even went to the national level. People started thinking that HIV was no longer a priority. So we noticed that the kind of interventions, the kind of initiatives that had been taken earlier started waning. People thought we can manage this. And of course, the early successes that we registered became a disadvantage to us. Everybody thought Uganda had done it. Uganda had succeeded. And the international claim that we had actually got, started working against us.
The first person to come out publicly to admit he was living with HIV/AIDS was music star Philip Bongole Lutaya in 1989. His song Today It's Me captured the national psyche and underscored the need for behavioral change.
Philip Bongole Lutaya gave a human face to HIV and AIDS in Uganda at a time when the disease was virtually unknown. At that time there was a lot of myth and a lot of allegations. People thought that maybe it is caused by witchcraft.
In the first 2 decades of the epidemic, the global community clearly failed to act, and the figures show it. From 1981 to 2000, the number of infected people increased from 1 million to 27.5 million, with Southern Africa having the highest prevalence rate. Uganda was among the few countries that took early action and implemented policies which collectively averted millions of new HIV infections. The infections reduced from 18% in the late 80s in some places to 5% by 2000. Currently, the prevalence stands at 6.4%. However, there is general fear of complacency that could roll back the gains.
One thing that we really need to understand is that ARVs are not a cure for HIV. So the main message should be that people should not get infected at all. Because once you are infected, the drugs can only alleviate your symptoms, but it's just a matter of time before you succumb.
The rate of infections could have gone down globally, but UNAIDS is worried that global funding to sustain this progress has declined for the first time in 10 years, despite a tremendous rise in the need. Globally, the total number of HIV infections remains high at about 7,000 per day, and the number of people living with HIV/AIDS is on the increase. In Uganda, 130,000 new infections are recorded each year, higher than the people dying from AIDS-related diseases.
They see the quality of life that the people living with HIV and on treatment, they see the quality of life improving. They assume that that is okay, and they think that if they get infected, they can access drugs.
According to the National HIV/AIDS Serobehavioral Study covering 2004 to 2005, sexual transmission accounts for about 76% of new infections, mother-to-child transmission about 22 to 25%, while others contribute to less than 1%. As infections increase, treatment needs have changed tremendously. Worldwide, 6.6 million people were put on treatment, but 9 million people are in waiting. In Uganda, about 550,000 people do not have access to treatment. But as the UNAIDS analysis shows, for every 1 person who starts treatment, 2 others become newly infected, and the cost of treating everyone eligible is growing exponentially. The country remains highly constrained in the fight against AIDS. The Prevention of Mother-to-Child Transmission (PMTCT) program is buckling under the weight of poor funding and limited uptake of increasingly available services. Social-cultural and economic factors such as failure to deliver in health facilities due to inaccessibility, for instance, exposes women to the risk of passing the infection to their babies. About 70% of the estimated 1 million infected Ugandans are not aware of their HIV status. HIV prevalence is higher among urban residents at 10.2% relative to 5.7% among rural residents. Geographically, HIV prevalence ranges from the lowest at 2.3 in the West Nile region to above 8% in Kampala and the Central and Mid-North regions. HIV prevalence is also higher among the married, widowed, divorced or separated people, those with other sexually transmitted infections, STIs, uncircumcised men, and women in the high wealth profile. Other groups associated with higher HIV prevalence include commercial sex workers, mobile people such as long-distance truck drivers, soldiers, and fishermen. A study in May by the HIV Prevention Trials Network showed that if an HIV-positive person strictly follows the antiretroviral therapy regimen, they can reduce the risk of transmitting the virus to their uninfected sexual partner by 96%. In its plans, UNAIDS aims at ensuring that every pregnant woman living with HIV/AIDS receives treatment to stop AIDS-related maternal deaths and also ensure that there are no more new infections among its children within the next 5 years. Florence Naluyimba, NTV.